One of the foundational strategic pillars of the Yale School of Public Health evolves around data science and data equity. Data science is a more familiar term for us because it combines computational and statistical tools ensembled together to solve important public health problems. But the notion of data equity is relatively new. It actually defines an ethos in which data science should be practiced, where everybody in the world, regardless of their background and circumstances, can benefit equally from data science innovations and products. In today's time, data equity is becoming an essential pillar of health equity because data is governing a lot of decisions around health. And if the training corpus and the training data sets on which all of these artificial intelligence models are being built is biased based on exclusionary cohorts, then people who are not in those data sets are always going to remain unseen, and their stories are never going to get heard. The decisions coming out of these engines are going to be only relevant for those who are in the data set. And public health has a major role to play in establishing this pillar of data equity in terms of studying understudied populations in the world, making our data sets and training data sets more representative, and promote the responsible, ethical use of AI, where we are asked to explain the intended use of the models that we are developing and the downstream consequences.
We've started amassing an unprecedented amount of data in health and just more globally, and it's now imperative that we actually utilize that data because it represents a huge opportunity to improve public health.
Historically, public health has been slow in getting data out there, and surveillance systems are slow, data systems have been very slow in the past, and we're at a point now where that's changing very quickly. Now we can get data almost in real time from healthcare systems. People here at Yale in our group are sequencing viruses in real time, combining that together with healthcare data and vaccination data to figure out, how a pathogen is changing and how that influences vaccine rates. So that type of thing can allow us to really intervene very quickly and provide that information to manufacturers who need to decide which strains to include in a vaccine.